Hi, everyone. Welcome. I'm here today with Dr. Jenny Yip. Dr. Yip is a clinical psychologist, board certified in behavioral and cognitive therapy. She's also an author, speaker, and a nationally recognized OCD and anxiety expert. So today, Dr. Yip is going to be talking about social anxiety disorder among teens and some signs to look for if perhaps your teen is suffering from this. So welcome, Dr. Yip.
Thanks so much for having me.
Thank you for being here. This is such an important topic that I think a lot of us are hearing about more and more these days. Are you finding that people are talking about social anxiety a lot these days, or is it just me?
I think not enough people are talking about
Okay.
social anxiety. I think a lot of people experience social anxiety, yet is too embarrassed to speak about it. And the fact that social anxiety is the third most common mental illness, again, I don't think we're talking enough about it. So I'm glad to be here to speak on this topic.
Yes, absolutely. So first, I would like to start by just defining anxiety disorder, just for those people who think they know what it is, or maybe they don't know what it is and they'd like to know more about it. Can you just kind of give your professional definition of what that is?
Of course. So, anxiety is actually a very common experience. We all experience anxiety, and it's actually normal to experience stress and anxiety. However, it's not an anxiety disorder until it actually debilitates your functioning. So, if you're not able to go to work, if you're not able to go to school, if you're not able to do your daily tasks, if you're not able to engage socially, that is a problem, and that is when it becomes an anxiety disorder.
Okay, got it. So we all have some sort of anxiety, but when it becomes a disorder, that's when we need to find some sort of solution or help for that
Yes,
disorder. Okay.
absolutely.
Okay. And then my understanding is that there are five common types of anxiety disorder: generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post traumatic stress disorder, and also social anxiety disorder. Is that correct?
Well, there are also phobias, and then also with younger kids, separation anxiety disorder.
Oh, okay. Do we know how many disorders or anxiety disorders there are out there?
I would say those are the common seven types
Okay.
of anxiety disorders. I think a lot of us neglect to um, mention separation anxiety because we don't really see it often in adults. We see that mostly in children, and therefore we neglect that. And phobias, it's not as spoken about, even though phobias is actually the most common anxiety disorder of all of them.
Interesting. So when would parents start to recognize that phobia in a child, would you say?
Well, if you have a child who is always anxious to a particular trigger. So for example, if there's a spider and your child is having a nervous breakdown because of that spider, that can indicate a phobia. Or if a child is commonly afraid of doors being opened, that child might be afraid of something a little bit deeper, such as having burglars come into the house, if they've heard about that. So depending on what the triggers are, and we'll talk more specifically about triggers, that determines what kind of anxiety disorder a person may have.
Okay. All right. Yeah, I definitely want to delve further into that. So let's start with today's topic, social anxiety in teens. So just very practically, what does that look like just for a parent that may be listening, not really understanding what that could look like in their teen? Like, how would you describe that? Maybe some
Well,
examples.
absolutely. So I think the first thing to distinguish is there's a difference between shyness and social anxiety. Social anxiety is not just shyness. In fact, they're completely different. A child who is shy may be shy to unfamiliar people and unfamiliar situation, and eventually once they get used to the situation or the person, they warm up to those triggers. For a person with social anxiety, they can actually be very comfortable in unfamiliar situations or with unfamiliar people. However, what they fear is being judged, and they're constantly thinking about what other people are thinking of them. They fear being embarrassed, they fear being socially awkward, they fear being perceived negatively, they fear being criticized. So that is really what social anxiety disorder means.
Okay. So because they have this fear, what is that preventing them from doing? Like, are they just shutting down and not speaking? Like, what could that look like for someone who's
It
having those
for
phobias?
for someone who is on the very severe end of social anxiety, they can be completely silent. They can be exhibiting a lot of physiological symptoms, such as their heart is racing, their hands are shaky, they're trembling, they're blushing, which again will actually make them feel even more embarrassed. So, those are just some of the symptoms that a person with social anxiety can exhibit. The important thing to remember again is that the person is constantly fearing being judged negatively. And therefore, even if they are in a familiar situation, they can feel like other people are looking at them in a way that person might be judging them. They can feel like other people are constantly zooming in on them. So it's almost like, when we were teenagers, and let's say we have a pimple, right? And
Mm-hmm.
when we go to school, what is it that we think? Everyone can see that pimple, right?
Mm-hmm.
Now, a person with social anxiety would feel that way even without that pimple. They constantly feel like all attention is on them. It's what I actually call reverse narcissism. So a person with narcissism is constantly trying to put attention onto themselves because they actually have a deflated sense of self, right? Actually, I'm
Mm-hmm.
sorry, they have an inflated sense of self.
Oh, right.
However, a person with social anxiety has a complete opposite. They're always trying to push the attention away from themselves because they have a deflated sense of self. So it's what I call reverse narcissism.
Interesting. So, just coming from a parent's point of view, how could they even discern that in their teen unless maybe the teen kind of opened up to them about what they were going through? Like, how do you think parents could be able to like recognize signs that their teen could have this?
Well, that's the tricky part because the onset of social anxiety disorder usually starts around that teen age, between the age of, 8, 9 to about 14, 15 years old. That is when social anxiety actually commonly starts. So, that is also the stage in the child's developmental period where they do become more egocentric. They do feel like that all attention is on them, that, they are the ones that everyone is looking at. And sometimes that is how a child feels, except the question is, does it debilitate their functioning?
Mm-hmm.
Is the child able to go to school? Is the child able to sit at the cafeteria having lunch with everybody? Is the child able to ask a question in class? Or is the child constantly thinking, okay, well, I can't raise my hand and ask a question because everyone will probably think it's a stupid question? Or is the child thinking, well, I can't eat in front of everybody because I might look odd or I might make noise that other people will just stare at me and think it's weird? Or is it, I can't even go to school because everyone is going to see how awkward I am and how I can't do this and I can't do that, and therefore I can't even go to school. So, the way that a child interacts with other people, interact with in social situations, interact in school, interact at sports, interact with their peers, is how a parent can usually tell. Is your child constantly telling you that I feel like everyone is looking at me negatively, that I can't ask a question because I think everyone is going to think it's a stupid question? I can't even talk to the teacher because the teacher will think that I'm just not smart enough. So if you're hearing those kinds of questions or those kinds of statements from a child, that's some indication that a teen is experiencing social anxiety disorder, and especially if it's interfering with their functioning.
Are you saying that this could start as early as 8 or 9?
Oh, yes. And it can actually start even before 8 or 9, even though, the teen years is the most common time that social anxiety starts. We have seen kids at my treatment center, the Renewed Freedom Center in Los Angeles, coming in, kids who are much younger than 8, who is already feeling like they're being judged and perceived negatively by their classmates in school.
That's interesting. So is this something that teens or kids develop as they grow, or is there like a chemical imbalance that is the culprit? Like, how would you describe like where these symptoms might be coming from?
I think that's the million-dollar
Oh,
question.
okay.
The honest truth is that researchers are still unsure what exactly are the factors that contribute to social anxiety. We do know that there are family members. If you have a family member that have social anxiety, then you're more likely at risk for having social anxiety. However, you can also have family members who have social anxiety, yet it doesn't affect you at all. We know that environmental factors can play a big contributor to developing social anxiety disorder. So, is it nurture? Is it nature? That's been the million-dollar question for centuries.
So, in just what you've seen in your practice, is this something that can be cured, or is it something that someone may have to suffer for a lifetime?
Well, first of all, there is no cure for mental illness. There
Okay.
are ways that you can learn to manage anxiety, such as social anxiety, and there's very effective treatment. The problem is that even though it's the third most common mental illness, less than 33% of people who suffer from social anxiety actually get treatment, or they wait for more than 10 years before they even seek treatment. So that goes on to tell you how little we're talking about it. Now, the specific treatment that you want to seek is cognitive behavior therapy, and that is the evidence-based treatment for social anxiety. So, cognitive behavior therapy means that we're going to teach you how to behave in ways that can manage the anxiety, the physiological sensations that you experience, so such as the heart palpitation, the heavy breathing, the trembling sensations that you experience during a social anxiety trigger. And then you're also learning how to observe the thoughts that you're having that may contain a lot of flaws and don't represent reality as accurately as it is. Now, research also shows that people with social anxiety tend to mistake other people's appearance to meaning that they are exhibiting awkward behaviors. So what I mean is that a person with social anxiety tend to fixate on other people's appearance and how other people may be judging themselves. So if a person looks a certain way, that must mean I am appearing awkward. Or if a person is making a comment, that comment must be directed at me for how weird how weird I'm acting. So a person with social anxiety tend to really zoom into other people's appearance or other people's what they say, and they tend to misperceive what other people are intending to mean. Actually, it's more than 33% of people with social anxiety wait for more than 10 years before they seek treatment. And that's true for both adults or children or teens.
Now, is that because they're just trying to deal with it on their own, or they don't think it's a disorder? Like, what do you think the reasoning is
It's
behind that?
it's a combination. They're trying to deal with it. They don't know that it's a disorder. also they're already embarrassed by how they might appear to other people. So by acknowledging, hey, I might have a disorder, it's the negative stigma that they're putting onto themselves,
Right,
right?
right.
So
Yeah,
if I have to admit that I have social anxiety disorder in order to get help, that means there really is something wrong with me.
right.
So it's a combination of a lack of awareness, it's also stigma, and not knowing where to get treatment. Of course, if we think about social anxiety in today's world, how are we interacting with people? Through social media, right? And if
Mm-hmm.
we think about social media, and there's tons of research supporting this now, so social media is actually doing more damage for our teens today than ever before, because social anxiety means that I have a deflated sense of self. I don't believe in me. I don't have the confidence that I need. And what does social media do? It adds to that perception,
Right.
because in order to feel good about yourself, what is it that you're doing? You're posting things on social media, you're hoping to get likes and followers. And if you don't, then you interpret that as, I'm not good enough.
Now, how would you counsel someone? Let's say it's a teen who maybe that is one of their issues. They don't get enough likes on Instagram, for example, and it makes it makes their issue a lot worse than what it could be. Like, how would you counsel them in that scenario?
To get off social media.
Oh, okay.
Right? I mean, what if you are going on social media, it has to be for a different reason than just to get likes and followers. Except the way that social media has transformed over the years is now just that, right? It's become an addiction.
Mm-hmm.
Back in the early days, the purpose of social media was really to interact with other people whom you might not be neighbors or who might live across in the world, and you can still make contact with them. It was a great tool to be able to reach people where you wouldn't be able to connect with them. However, in the last 2 decades, it's transformed into something where, in order for these social media platforms to gain users, they've added all of these tools to gain more users. So therefore, they added likes and followers. So now, in order for you to engage, you want to get likes and followers. And how do you get likes and followers? Well, you post more and more and more things in order to get more and more and more people to like and follow you. So it's become this phenomenon where we have so many teens who are completely addicted to social media. And come on, I mean, selfies. Did we have selfies back in the
I
days? No,
know. I know.
we didn't have selfies. And what's even worse is now we have these smartphones that can transform your selfies into a portrait, into something that really doesn't look like you, and you
Right.
post it, and then everyone is comparing themselves to that selfie that you took, which you have actually manipulated with your smartphone, right? So social media is no longer used just for interaction and engagement with other people whom you wouldn't be able to engage with. It's become this phenomenon where people are just trying to get as much confidence as possible, to get as much validation as possible for their sense of self, for their self-worth. And unfortunately, if you're using social media for that purpose, then some people will be very, very disappointed by that
Yeah.
when they don't get the followers and the likes.
Mhm. Now, let's say someone has grown out of that phase. Let's say they've left the teen years and they're not even into social media anymore. Is this social anxiety something that someone could technically grow out of? Like, have you seen people like mature out of that, or is that something that'll follow them the rest of their lives?
It's not usually something that you just grow out of. It's not like having a tick and as you
Yeah.
age you just grow out of having a tick. With social anxiety, it is a belief system that I am not good enough, that I don't have the social skills, or that I don't have whatever skill to be liked, to appear in the way that other people will accept. Um, so it isn't something that you just grow out of. You really have to be able to go through treatment in order to understand how you do have qualities that you don't need validation for. And who in the world cares about what other people think, right? I mean, in
Yeah.
reality, and it's not something that you just grow out of if you truly have social anxiety disorder. Now, a lot of people also think that social anxiety disorder only happens to that shy kid or to that kid who's quiet and sitting at the corner. And that's also not true. That's a myth. There are a lot of kids who are the most popular kids in school, who are the star athletes, who are the star stage performers, who also have social anxiety. So many of our celebrities have social anxiety. Again, social anxiety means that I fear being perceived and judged negatively. And no matter what I do, it's not good enough.
That's so interesting. Let's say someone is choosing not to get help. They know they have social anxiety and they're choosing not to get help for themselves. Like, what could it lead to? Like, I've heard that some anxieties can lead to depression. Like, are there some extreme
Absolutely.
cases? Yeah.
Well, there are common comorbidities with social anxiety. One is depression, the other is substance use. So if you have social anxiety and your life is completely debilitated by it because you can't go on job interviews, because you feel like you're being judged negatively, you can't interact with your peers and make friends, and therefore you don't have many friends, you can't really interact with your family because you're constantly fearing that your family members are criticizing you, even whether they are or are not. That means you're leading a very isolated life. And we
Mm,
all know that in order to have a quality of life, your social support network is the most important factor to leading quality of life. So
right.
if you don't have that social support network, that means that it is easy for you to experience depression. And
Mm,
then on the other end, some people, because they feel so anxious in social situations, they resort to substance use. And substance use help to take away that edge so that they feel like they can engage with other people without fearing being judged. And therefore, substance abuse starts to occur. So those are the two common comorbid disorders with social anxiety disorder.
okay. Now, let's say, just going back to parents and teens, let's say a parent notices that their child has some sort of social anxiety. Maybe it's not to a medium stage or even a major stage, but it's still in the mild stage. Is this something that they can just treat practically at home, or do you think that even at a mild stage they need to seek professional treatment?
Well, the most effective treatment again is cognitive behavior therapy. A part of the cognitive behavior therapy is exposures. So exposure therapy means that you are learning to confront your fears, confronting those specific triggers to your fears. So if your trigger, let's say you're a star athlete, right? And
Mm-hmm.
let's say that the trigger is if you miss a shot, or if you fumble, or if you perceive the people up on the stadium and everyone is looking at you angrily. Well, part of um, exposure therapy is to purposely go out there and play, even if you do make a fumble, even if other people are looking at you angrily. You can't care about those specific triggers and those specific external factors, because if you do, then you get too much inside your head. And once you're inside your head, then that is when that I call that your tornado of anxiety, your worries starts to occur. And of course, if you're going to have one negative thought, that negative thought is going to trigger another, going to trigger another, it's going to trigger another. So if you can help your child, and to be honest with you, this is true for all anxiety triggers, not just social anxiety. From the time a child is very, very, very young, if a child is experiencing anxiety to a particular situation, and if you go and immediately fix it for the child, or you rescue the child from confronting or learning to confront that specific trigger, then what you're really implying to the child is, yes, you do need to be afraid of the dark. You do need to be afraid of the closet. You do need to be afraid of water. You do need to be afraid of other people. Right?
Yeah.
However, if you let the child learn to tolerate those triggers, learn to tolerate their bodily discomforts, then what you're helping the child to do is build resiliency that leads to confidence. That reduces the fear.
Yeah, that makes perfect sense. And I know this is your area of expertise. Do you also use any type of medication to treat social anxiety?
Medication can be used as well. However, medication is usually used for short term. And for children, if they can tolerate cognitive behavior therapy without medication, that's always the best option, especially if a child is very young. Medication is usually used in conjunction with cognitive behavior therapy, or if a person is so severe that they can't even get started on cognitive behavior therapy. And if a child comes into our treatment center and they're not already on medication, we usually don't start medication.
Okay. That I'm gonna definitely put your information in the show notes so people can reach out if they have more questions or they just want to delve further. Is there anything else maybe for parents that you think they should look out for, as far as signs that their child may be suffering from this social anxiety disorder?
Anytime a child is avoiding specific situations because they fear of being perceived negatively, that is a sign of social anxiety. Anytime a child is avoiding any situation for fear of whatever, that is a sign of anxiety. And if the child is able to avoid a situation enough, then they really don't get to relearn, retrain their brains that actually this situation is tolerable, it isn't so threatening. So you have to help the child correct their faulty thinking by allowing them opportunities to confront their fears. Otherwise, if they're avoiding, they're never going to have the opportunity to correct their mistaken beliefs. And that is where the exposure therapy comes in.
Okay, perfectly stated. Thank you so much, Dr. Yip. This was so helpful for me, definitely, and I'm sure a lot of other people that are listening. If you want to know more information about Dr. Yip and her practice, you can visit her at dryip.com or renewedfreedomcenter.com. Thank you again, Dr. Yip, for your time.
Absolutely. Thanks for having me.
Thanks so much for taking time out with Tinseltown Mom. If you liked what you heard today, please be so kind and rate, review, and subscribe on iTunes or wherever you listen to podcasts. Until next time.